All right, so it is just after 1 o'clock, so let's begin. Hello, everyone. Thank you for joining our fifth Healthcare Administration Career Pathways event. These online panels are designed to provide healthcare administration students at St. Lawrence College and prospective students with more information on the potential pathways they can choose for their career. And who better to get that information from than those who are actively walking those paths, our graduates. So please note, today's session is being recorded. For those of you who are new to our Career Pathways events, we'll invite each of our panelists to share their personal story. We'll hear about their education prior to arriving at St. Lawrence College, their time at the college, and most importantly, their life or their journey into life after graduation. And then we'll open up the microphones and the chat line so you can ask questions of our panelists directly. We have another excellent lineup of speakers with our main focus today on internationally trained nurses. So two of our panelists graduated in 2020, launching into the COVID-filled system directly. So I'd like to start with them today. So first up is Kenya Mina, who came to St. Lawrence College from Brazil, where she worked for 7 years as a in geriatric care and emergency rooms. Aside from being an excellent student, she's been juggling a very full plate in her many roles as a student, mother, wife, etc. And she seems to do it all with a big smile on her face. And I think it's part of her amazing attitude, her creativity, and her willingness to shift gears when needed that are among her greatest assets that I admire. So without further ado, I am going to stop sharing my screen now and turn it over to you, Kenya. All right, I've just got you on mute here. If you can unmute yourself.
Yes, can you hear me now?
Okay. We can hear you, yes. We can't see you yet. Oh, there you are, okay.
I'm here.
Excellent. Do you want to just provide us with your introductory comments and give us a little bit about your story?
Yes, so as you mentioned, I am a nurse. I graduated in 2011. That was a long time ago. Don't try to guess my age. I came from Brazil here to Canada in 2019, April, and I came with my family, my husband, and my daughter. I do have a teenager daughter. We decided to come to Canada because we wanted to have a whole different experience as a family, learn more of the language and have the opportunity to give her a better future. And of course, work here in Canada. It's my dream to work here as a nurse, and that's what I'm trying to do. That's my pathway, The experience it's been amazing. I've loved it, every aspect of it. I know during COVID things are tough, but still everything is going well. And I've graduated in July 2020. And right now I'm working as a personal support worker and also working at Providence Care Hospital as a support nutrition assistant and as a nurse assistant.
So what do you do in your spare time?
That's a good question. I've been trying to be active, doing things around the house, exercising, going out for a walk and taking care of my daughter. And we like music. We are not musician, but we do like music. So my husband plays and we sing, and we've been making videos and sharing videos with friends over social media. So we're keeping ourselves busy.
Good. And you mentioned that you're working as a PSW, and I know you started working as a PSW while you were a student.
Yes.
Is there a pathway kind of going into nursing that you're exploring right now?
Yes. I'm also affiliated with an NAS, so they're accessing my credentials because my hope is to become a nurse, of course. It's a long process. I didn't start until beginning of last year, beginning of 2020. It takes a long time until you gather all the documents you need. You need to get a letter from the place you worked back home. You have to have all your transcript from your college, your university that you went to. You also need to get a letter from the College of Nursing in Brazil. So all takes time. And I was doing this during COVID. So all places were closed. It was hard to get all documents that I needed. But I am in the process, and I'm hoping to get a response soon so I can start. And I'm also studying, because I know I will have to take some exams. And I think some of you can talk more about that later. But I did start working as a PSW while I was still going to school here. And most of the agencies here in Kingston and Ontario, they will see you as a PSW, even though I did not went to school for personal support assistant. But I know that if you want to work in a hospital as a personal support assistant, you need more. So I did become a member of the OPSWA, which is an agency here in Ontario. So I submitted all my documents to them, and now they acknowledge me as a PSW. So I am an official PSW right now.
Excellent. Great. We'll come back to you and ask some more questions in a bit. Okay?
Okay.
Thanks so much. Next up is Amala Bijou, who is an incredibly hard worker and who is clearly passionate about providing quality care for people. When COVID hit and classes moved online, Amala was busy caring for Kingston area residents, also as a PSW. And then she answered the call and moved to Toronto when everything moved online, working and balancing her studies. So it wasn't uncommon for her to join a class or a capstone meeting from a break room wearing a mask. And I know when we think back to the unknowns of COVID and the incredible work done by our students and graduates, the image of Amala in a surgical mask always comes to mind for me. So I will turn it over to you, Amala.
Thank you, Julie. Good afternoon, everyone. So my name is Amala. I am an internationally registered nurse, and I'm from India. I joined St. Lawrence College last year, September 2019, and graduated in December 2020. So when talking about the nursing pathway, so currently I'm working as a PSW in a long-term care home here in Toronto. And also, as you can see, I'm dressed up because I'm going for my shift. So I thought it's necessary to share how I have or how I am at my nursing pathway in Canada. So basically talking, it's much difficult right now attaining a RN or becoming an RPN for especially the international trained nurses, because the Canadian standards have been like Kenya said, it's a long process. So I started my NNAS back home. Before coming here, I did all my paperworks back home. That's by 2019. I submitted all my paperworks from India itself, so that it should not take long. My plan was that once I finish or once I graduate here, I'll get my nursing credentialing done here. So that was my plan, but unfortunately, due to COVID, it got extended. So currently, I got assessed for the RN, and I'm waiting for appearing for the OSCE. But due to COVID, the exams has been postponed, and still, like Inya said, I'm studying and also preparing while working, and also I'm doing a PSW course because for working in a hospital or getting a clinicals getting into the field, we need credentialing as a PSW. So I thought of taking an online PSW course, and I'll probably appear for the NAC exam in May. And also I'm going for my RPN. So everything is going parallelly with all these. And also I'm looking for something related to administration as well. But I want to be in the hospital setting or in the healthcare. That's why I'm continuing PSW. So I don't know. Everything is going like all the internationally registered nurses. This is the same process. Either we are with the NNAS or with the CNO, and yeah, it's a tough process, but we will get there.
All right. So do you recommend that people start back home,
Yes,
collecting their
yes,
information?
yes, because like Kenya said, it's a long process. Because like 8 years back, there was just the NCLEX RN exam, but now it's a long process. We start from NNAS. It takes about 2 years, minimum of 2 years, to get the credentialing done. Like we have to send the papers from our college, from our employment, from our university, and they have to be mailed from the college, and it should reach here. They should analyze it, they should make a report. It eventually takes 2 years. And like I started it from back home like 2019, and I got my NNA's report in May 2020. So it was like approximately an year. And then once we get the report from the NNA's, we need to submit it to CNO. That will again take approximately 1.5 year to get the report. And then finally, once the CNO says, okay, your education is matching with the Canadian standards, you can appear. Or else we need to take courses. Like it's kind of complicated. If the CNO says you can, I'm telling about the RN. If they says we have competency gaps, even if we have the experience or we have the education, they'll ask us to do some courses, or we have to appear for the OSCE. And we can choose. If you want, we can do the courses, but it's pretty expensive, so we cannot go for the courses directly. So either we'll go for the OSCE, and if we clear the OSCE and if we fill the competency gaps, then we can go for the NCLEX RN exam. That's for the RN. And if it's the RPN, I think it's when comparing RN with RPN, it's easy to get the RPN for the internationally registered nurses, because if we have a pretty good amount of experience back home, and they look for the graduation year as well. And so once they analyze it, I think they will give permission for writing the CPNRE exam, and then we can go for RPN. But in my perspective, I feel getting an RN done here, it's pretty much difficult. Yeah, either we have to do a course or pass OSCE, but we cannot pass OSCE just like that. It requires a lot of hard work, a lot of studying, like continuous 3 months or 6 months. I've seen my peers, my colleagues, my seniors, like they go for studying like 6 months, but they do that after they get PR. We cannot balance between work, going for work, and coming back and studying. So just study, like keep your mind straight, study for OSCE or do any course. That's it. It's pretty much complicated and it takes time. So
Okay, great. And PR
it's
applications,
a lot of
is that is the PR application a difficult thing for you to do right now, or is that something you just?
So like if it's straight, we graduated from the healthcare administration program. We get a B-level job. We acquire a 1 year of experience, and then we go for a PR process. It will take about like 4 years or so from starting from our student period. Yeah. So by the meantime, we can complete all these paperworks, and you will get a decision from the NNAs or the CNO. So once you get the PR, or before that, you know what to do next. So that's why I recommend all the future nurses who are planning to come to Canada to complete all the paperworks back home, send it here, and then you can study here peacefully. And while you finish, or while you come for your graduation, your paperworks will be ready, and you will get to know what you have to do next for your nursing career here. And
Right.
that's what I did.
Okay. So have you got your COVID vaccine yet?
Well, not yet, because I'm not planning to. I don't know, because I have been reading a lot, I have been seeing the news a lot, and personally, the residents I have been working, like all the residents and all the staff have been vaccinated, but now we are in an outbreak, and those who were vaccinated are positive. So the question that comes to my mind is that, then what's the purpose of being vaccinated? Like we know, like they are itself saying that there's a chance of getting COVID even if you vaccinate, but they say it's like, preventing the side effects. But if you eat good, if you take the necessary precautions, if you use the PPE correctly, I personally feel that we could prevent it, like maintaining social distancing. So till now, I'm not being tested positive, and I have not been vaccinated, and I'm working very carefully using all the precautions. And I don't know if they make it mandatory, probably I will have to take, but not gonna take it right now.
All right. Well, you stay safe. We'll probably come back to you though. Okay.
Okay, thank
All
you.
right. Thanks so much. And our next speaker is a student who I know down to my core is driven to succeed. Akila Krishnan is extremely organized and I believe has her goals clearly set. She's a registered nurse, again, trained in India with 5 years as an RN and as a nurse coordinator in a maternity and pediatric hospital. In Canada, she's worked as a personal support worker, and when she graduated in December 2019, went right to work as an administrative assistant at the Galen Eye Center, in a position that was likely aimed at securing the requirements of permanent residency, I would believe. Her sights are continue in nursing, and I will let her share those goals and her pathway with you. So over to you, Akila. Oh, I think you're on mute. You there?
Yeah. Hi, I am Akhila. I came here in Canada in 2017 and I completed my graduation, like PG diploma in healthcare administration in 2019. As like everyone, it was one of my dreams to come here in Canada. So for that, I did a lot of research. I went through many courses like critical care nursing, gerontology nursing, like many courses. I did research, and at last I decided to come and join healthcare administration, because I thought anyway I have 5 years of experience, and so I want to know like what's going on in the administration area, what's they are doing behind the screen, and that's why I decided to take this healthcare administration program. So to say about my journey here in Canada, like when I came here as a student, my first priority was to find a job in healthcare area. So that is the only area I concentrated to get a job when I was a student. So I went through Google and I make a list of like almost all the retirement homes here in Kingston, and also the long-term care areas. So and then I started to submit my resumes through online and also in person in almost all the retirement homes. I think I submitted my resumes here in Kingston for about I think nearly 10 retirement homes. Some I still remember like Waterford, then Kingsdale, Chateau, then Royal, then Arbor Heights. Under this, there is an organization called Sienna. Under this Sienna, there are still many more retirement homes are there. I submitted my resume to all these organizations, and also in long-term care facilities like Providence Care, Providence Manor, like in many places. That is the only area I concentrated to get a job when I was a student. And like after I will say about 2 weeks of job hunt, from Waterford they called me for interview and I got a job there, and throughout my student life I worked there in that Waterford retirement home. I will say I got many learning experience from there. So I got the opportunity to interact with different residents who have different disease conditions, and also I got the opportunity to interact with many nurses there. They helped me to do many of the paperwork for to get my nursing credentials. So I got many learning opportunities from there, and also I submitted my papers to get a voluntary job opportunity in Kingston General Hospital. So I thought I just want to know what's going on inside the hospital here in the Kingston. So that's why I applied for voluntary job opportunity. The paperwork for this voluntary work opportunity is quite complicated in Kingston General Hospital. For me, it took almost 3 months to complete the paperwork for this voluntary work, because they want to know all our immunization status, then different blood works, then X-ray, then tuberculin skin test. They will ask for a lot of blood reports and like investigations. So we have to submit all those papers. So for me, it took almost 3 months to submit all those papers, and I started to work as a voluntary worker in Kingston General Hospital too. So from there also I learned many things, like I I saw how the hallway medicine system is going in the emergency area. So how about the waiting systems there? So these are all the things I tried to learn when I was a student. Then to say about my journey to the administration field, I will say like from the very first week of my last semester, I started to search for a job in the administration field, because my priority was to get my permanent residency here, in Canada. So I thought, there are many job categories that will come under this healthcare administration, which will help us to get our permanent residency. So the scope of this healthcare administration is very vast. I will say the job opportunities are like very vast, because we can go under different job titles once we complete this healthcare administration program, like care coordinators, medical administrative assistants, then administrative assistants, then bookkeepers. Many job opportunities are there. All these are like job categories which will help us to get our permanent residency. So I started to search for my job, as I said, from the very first week of my last semester. And after 2 months of like job hunt, fortunately I got a job as a medical administrative assistant here in Kingston, in Gallen Eye Center, and I'm still working in that organization, and I'm very happy about my job.
Excellent. Thank you so much. That was very well put. And is it a job that you're going to stay in for a while? Are you looking to seek licensure, or what's?
Actually, right now I'm very happy with my administrative assistant job,
Yeah.
but at the same time, I want to get my nursing credentials here too. So to say about that, I started my nursing paperwork from my first semester itself. As like Amala said, for me it took almost an year and a half to complete all the paperworks of nursing. So as like she already explained, that first we have to submit that, we have to create an account in NNAS. Then we have to submit all our nursing experience, our education in that account, NNAS account. Then they will ask for the proofs. So they need the proofs directly from the organization that we studied and we worked. So for me, my paperwork was like quite complicated, because my one experience was from India and my other experience was from Saudi Arabia. So it took a lot of time to get every papers reached to the NNAS. So for me it took an year and a half for to get my NNAS report. After that, once I get my NNAS report, I submitted my papers to CNO. Again for CNO, it took again 6 months, because again CNO asked for my job description, evidence of practice. Again, they asked three more papers again. So again it took a lot of time to reach all those papers from my employers to CNO. And at last, CNO gave me the eligibility to attend RPN and to attend this OSCE for RN. So I am planning to get my accreditation in nursing too.
Excellent. Well done. I know it's a long, arduous pathway, but I'm glad to hear that we've got graduates who are certainly finding their way along, and really, in the grand scheme of things, it's fairly quickly, despite the fact that it may seem like it takes a long time to get the paperwork together.
Yeah.
So
So,
awesome.
so to my friends, what I should say is like, don't wait. If you want to be a nurse here, just start your paperwork today itself. That is what I should say.
Okay. And do you recommend the healthcare administration program, though, to kind of get you through that gap? Is that helpful?
Sure, many things that we are studying in healthcare administration program help me a lot. For example, in our program that we covered ethics and laws, that same ethics and laws helped me to attend nursing jurisprudence examination. That is one of the requirement to get the eligibility. So there are many things that will come under this healthcare administration program. Is very helpful to attend the nursing examination. So don't take anything silly or unimportant when you go through this program. Each and everything that they are doing in this healthcare administration is very important throughout your life, such as communication, like decision making, leadership, especially I will say this ethics and law.
Excellent. Thanks so much, Akila. I really appreciate that. And we'll, again, probably come back with some questions for you. I'd now like to call upon Rebecca Lee, who I believe graduated at the end of 2019 as well. Rebecca came to St. Lawrence after working more than 15 years in emergency and as a pediatric intensive care nurse in China, among other locations. Rebecca is a quiet young woman with an incredible appetite for learning. She's someone who I just keep seeing as getting stronger and stronger every day. I'm so proud of Rebecca's achievements, and I'm really interested to hear more about the career path that she is on. So over to you, Rebecca. You can turn your mic and your camera on. Hopefully we haven't lost her. You're on mute, Rebecca, if you're talking.
Now it's okay.
There we go. Now you're okay.
Thank
There
you.
we go. Now we can see you too.
Okay. Good afternoon, everyone. My name is Rebecca. As Julie said, I come from China. So I was a student in St. Lawrence for healthcare administration from 2008 to 2019. And I have a little bit different with my classmates is before I started in St. Lawrence, I have almost 19 years working experience in China as a nurse. And the last 7 years, I was the head nurse for the pediatric department. So one reason why I choose healthcare administration because I want to improve my management skill in case if I cannot stay here back to my country and I can continue my career there. And also another reason is I don't want to restart my career in any other field. I want something related to my experience so I can continue to do some work is similar with before. And also the last reason is because according to my agency, they told me this subject is easier to find job, can help me to immigrate here soon. So this is all reason why I choose healthcare. And now I live in Oakville. It's a small town between Mississauga and Hamilton. It's not very beautiful and quiet like Kingston, but much better than Toronto. I work in my medical clinic for a family physician. Like my routine work, including front and back. Front side, like the receptionist, I booking the patient, receive the fax, the phone call, record everything, bill the patient. And in the back, I am a nurse for my doctor. I check vital signs for my patient, give the vaccination or medication, change dressing, and also doing the blood work. If my doctor have any like simple procedures such like wound treatment or some sutures, I will be the assistant for her. I feel that 2 years healthcare administration programs really helped me a lot and very important for you if you work here. Like I know the Canadian healthcare system and policy here. Also, I know some working floor for the if you the patient want to see the doctor or want doing some procedure in the hospital. Also, you will know the patient privacy, the rights, and how to protect for them and for the work during the working the communicate very effectively with your patient family members and you can do the very good team job with your colleagues. Also, I learned the critical thinking during these 2 years, and now when I face to some hard situation, it can help me to find the good solution very soon. So I think this 2 years is very important for everyone if you continue work here, if you want to work here as a medical staff. And also that 2 years improve my language a lot and also the culture here during the class, the presentation, and the school events. For me, looking for the job is a long procedure and after I graduate, I send the resume. I'm more focused on receptionist side because I feel that is a huge opportunities there. So I use application like the Indeed and the Glassdoor. I feel this tool is more clear and easier for me. So I book appointment with the student service to let them help me to make a wonderful and amazing resume and the cover letter. Their group is really professional, and after that I just send the resume from the Indeed. Like each day I send around 30 to 50, and I will make the list. I write down the date, the clinic's name or the hospital's name, and the position title, the location, and also if I got any chance to interview or online test, I will mark there the response from them. So every week I review this record. I will see what part I can improve a lot. It also helped me to find the job very soon. And I went to every interview I got. So maybe I cannot find the job from this time, but I can get some experience from them, and I can be more stronger and confident for the next time. So I feel this 2 years, the healthcare studies really helped me a lot for my works now. I think you need to enjoy the class there. That's all. Thank you.
That's excellent. Thank you so much. And it's really good to hear kind of what your experience has been and how you found that job. I know you were anxious about it at the end of the school system and or at the end of your schooling time, and how to actually approach getting that job. So I'm glad you found some great resources. Are you looking at going through the CNO process as well, or are you kind of waiting till you get PR and happy with the position that you're in right now?
I enjoy my work now because I still can be a nurse as my doctor. So I do the blood work, I do the injection and some small procedures here. And I plan to study as a nurse in the university here because I have the bachelor in China. So I confirm with some university here, like I need maybe around 2 to 2.5 years study for the RN program. So I prefer I can get PR this year. Then I started to start to study nursing, and I know to be a nurse here through the paperwork is very long. I prefer to study more, so I plan to go to university after I do PR.
Excellent, great. Thanks so much, Rebecca. And I am amazed at your language and your speaking, and I think that really attests to the amount of work that you've put into it as well. Well done, very well done.
Thank you.
And we'll probably come back to you with questions as well.
Sure.
All right.
Sure.
So we're hearing a lot of resiliency among our students and graduates. And speaking of resiliency, I now would like to call on Saloni, I can never say your last name correctly, Katri, I believe, who is a master's trained nurse in psychiatric mental health nursing from India. Saloni was another gregarious, energetic student of mine who was always engaging, and she's someone who I always will remember supporting the people around her. She's a smart, quiet leader who has a heart of gold. And I truly believe that she exemplifies the adage that all good things come to those who wait. So I'm really proud of Saloni and her career pathway, which is a little bit different than the rest of those that we've heard as well. So over to you, Saloni.
Thanks, Julie. Thanks for appreciation. I hope everybody can hear me. Hi. So my name is Saloni. I did my bachelor's in nursing from India in 2010. And then I was teaching as a clinical instructor in India for 1 year. And after that, I pursued my master's in mental health nursing. And then I was teaching in nursing college, teaching nursing students for 3.5 years. So that was a very amazing experience to me. After that, all of a sudden, like my life changed in 2016 because I never planned to come to Canada, and all of a sudden I got a path my friends were applying, so I just like, okay, I will also apply. But I got approved for my studies, like for healthcare administration, and when they didn't, so I was like amazed, like what has happened. So I'm like, okay, I'll go. I'll see what happens, what the Canada has for me. I took this course. So as soon as we found like it was difficult to adjust in this environment because it's different than your country and everything was new. So our classmates were all Indian, so we supported each other mentally. So that was a kind of strength to me. And then our teachers were so guiding us. We pulled through the course, and in that time, I didn't have a job in first month. I waited so that I could study well. But then I got a part-time job in Tim Hortons. But a workplace injury, I couldn't do that too. So I have to hold that back. As soon as I passed my course, I got a convenience store job as a shift supervisor. So I was doing all the office work there as well as some cashier work too. So that guided me to understand the community in Kingston, how people live, what they eat, what their lifestyles are, because that was the most closest interaction I had there. And most of my customers were healthcare workers. So they helped me to understand and motivate to apply to my field jobs. Then I got some Indeed advertisements and then applied for a case manager job in mental health nursing. And I got approved for that. Actually, I applied for a crisis worker. It was a casual job. The interviewer who interviewed me was so impressed. She offered me a full-time job as a case manager on one of the ACT team. ACT team, they are the teams that look for the mental health clients in community. So I got that job, and currently I'm working. It's been a year. I'm working as a case manager on an ACT team. So I am participating in community mental health projects and the home-based housing projects, like providing homes to the homeless people. So that's kind of a kind work that I can do. I have started my nursing license NNAS evaluation, and because of the COVID, it's been elongated and it's taking time. So that's it. But for my PR, I got my PR an year ago. I didn't realize like I was eligible way before, because when I was working as a shift supervisor, it was not even like 1 year complete, but I still applied my file in the pool because I was doing all processing by myself. So that was like when you explore new ways, what you can do, what you cannot, because many of the people that help you going through, your friends, they help me. So when I submitted my file, my points were only 408 when cutoff was 54. But I applied the same. I got invited the same night I applied. I didn't realize like my master's experience from India would be valid, and the category which I choose to apply my experience to my PR was a very innovative way, because most of the people, most of the nurses who teach in the college, they try to find the nursing tutor category in NOC categories, but actually it is vocational teaching. So if you go and apply for that, your Indian experience will be valid for your PR, whatever you have done, like whether it's a clinical or it's in a college, that will be evaluated and that will give you extra 50 points. So that was the how. I submitted my file on 408 and I got invited on 498. Another myth that we have when we apply for the PR is that we need 1 year experience. So we wait like till our first 1 year is completed and then we apply for PR. But instead, if you applied on the 10th month, they will calculate your 1 year. If your employer gives like this person is on this contract and that's going to last for a year. So they will give you an invite 2 months before your 1 year is completed, because two months is the process time that they counts towards your PR. So So you don't have to wait for so long. So it's only like 10-month wait after your work permit. When you start full-time work, you can apply for PR, get your file in the pool, because you never know what qualification that you have will be evaluated by your evaluator. Because PR people, they evaluate your profile. They don't go for like all the things. Like they look through whatever the job category you have applied. They see what is your detailed work experience and they give you points according to that. And but after that, I got my invite. I submitted my file, but I was waiting for my PR approval, and that was in waiting for like 10 months. So you can go to the local MPP after 6 months, request them to help you. So I went to the Mark Geretson's office. They assigned me a case manager that helped me to get my PR as soon as possible. Because if they put an inquiry, uh, they have to, government has to reply to them earlier than they reply to us. So that was my journey.
So you go to your member of parliament, the federal member of parliament, to have that assessed.
Yeah, because Mark Geretson's office, they provide a case manager on my file to see like why it is getting late, why it is not getting evaluated. So they put an inquiry on that. So they got response faster than my consultancy services.
Excellent.
Yeah.
Fantastic. And this is a bonus for everyone who's listening, because we don't know what we don't know, and sometimes things aren't written. So hearing this is really, really important. And you're obviously, sorry, are you working then towards your CNO as well, Saloni? Are you?
Yeah, I have started my NNS evaluation in 2018, but due to COVID, and I don't have many people in India who can go and submit my paper on my behalf.
Okay.
Because in my state, my parents has to do, and they are health compromised, so I cannot ask them to go and do work for me for COVID. So that's why it's ending right now.
Okay. So there are jobs though, and that's what we're hearing, is that you can find positions and work towards your PR at the same time while you're waiting for these pieces to get into process.
Yeah, many graduates who come from different countries, they think that they are not eligible, but actually it's IELTS score. So if you are under 30 and if your IELTS score is 7 in each module, you are like 98% eligible for your PR once you complete your studies by the time.
Excellent.
So I got my PR within 3 years. I came to Canada. Even they were complete 3 years.
Excellent. Okay, let's open up some questions to everyone. I'm just curious to hear if anyone attended any of the Health Force Ontario sessions. I know they have regular sessions for various positions. Did anyone on our panel attend one of the Health Force Ontario sessions?
Actually, I have mailed them for registering with the International Educated Nurses webinar, but I think they had a high volume of email session. I didn't get a response. So,
Oh, no.
Yeah.
Okay.
But I think they have a session like in every month or 2 times a month. So if we keep with like, I think we need to do it as early. Like it's through email that we register. So probably if we do it as soon as possible, I think we'll get a response. So
Okay.
and then I couldn't get time. So
You're busy working too.
yes.
All right. So how did you find out about the steps needed? What did you guys do to find the steps needed to figure out what your career pathway was going to be?
So for me, so I had like I said, I had my relatives here and my friends and my seniors. So they were going through the same procedure. So before, like I knew that I had to come to Canada and I had to pursue the nursing career here. So before coming, I talked with them and I like not with just one person, talked with as many people as possible. Like and I came to know or like what did they do and how did they do. And I also went through the websites, read the handbooks, so research a lot, like reading and talking with the people, it brings a lot of difference. So I did that before coming here. So I have a notebook through which like I write down like what are the steps that we have to do, what are the documents, like we don't want to miss anything. And like Saloni said, even my parents, they are health compromised, so if I have to do something for me, I have to take the like I have to do it by myself. So I cannot come here and tell them that you have to post this or can you do that for me. So I thought if I'm coming here, I have to do whatever things I have to do back home. So I have to finish that and then I have to come here. So before coming here, once I finished my studies, I went through so many agencies, contacted so many persons, like Akhila said, thought of taking so many courses like critical care nursing, and then had to think about getting the PR, about the stay back. So it's a lot of things. I would say like talking with your friends or anyone or contacting through social medias. Even I did that. Even if I didn't know the person in person, I talked with them. Like I had a message on social media saying that he's doing healthcare administration at St. Lawrence College, or she's doing. And I texted, I wanted to know how's the course, what's the future, how's the job opportunities. So that's what I did. I think we all do the same. So
Okay.
Julie, I would
Yeah.
like to explain here about the CARE. That's a program that's specially for international nurses that
Yes.
many international nurses can connect to, and they will evaluate your profile and they will tell you what's next to be done. So that can be a proper professional guide to them. Every nurse who is an international and coming to Canada and doesn't have many people in connection, they help you establishing connection, evaluate your profile, help submitting your paper to NNAS, so that can be done. And I think so Michelle Gordon, who was a professor at our times, was a representative of them.
Yes.
Yeah, so
Okay.
that can
So
be done.
did you reach out to CARE directly, or did you go through Keys?
Actually, I didn't go to Peace or I didn't go to CARE because I read all the material on NNA's website.
Okay.
When you go to CNO also on their website, they explain you the whole procedure step by step, and they have a handbook that you can download, read, and highlight. That's what I did.
Okay.
And other than that, once you have your CNO approval, like you have been approved to be an RN, I think they can give you a temporary 6-month license that can help you to get a job, at least secure a position. So as soon as you give your exam, you pass your exam, you are eligible to work as a nurse.
Okay.
and yeah, I reached out to Care through email. So like they offer a course that's 6 months, so we can international registered nurses can take that course, which will help us to complete the competency gaps. But the three main things that we should have a PR here, and we should have an account with the CNO, and the report should be in process. So that's what the three things. So it's better to not to take any university courses because it's expensive, and comparing with the course that Care is offering, it's better. Yeah, so
Okay.
I have reached out to them. That's through, yeah, like the NNAS.
Okay. And Kenya, I know you mentioned that you are grandfathered in as a PSW. Do you want to talk a little bit about that process as well?
Yes. So for nurses, international nurses that are having difficulty finding jobs, especially if you want to work as a PSW in a hospital, this is a wonderful opportunity. You can go into their website. It's OPSWA. So it's Ontario PSW Association. And then you submit all your documents, and then you do have to pay a fee, which is your yearly membership. And they will evaluate all your documents, and they will give you a license, a membership, stating that you are an official PSW. And I submitted all my documents, and 2 days later they responded. So it's very quick. They sent me my license, and now I am an official PSW. So it's wonderful. If you don't want to go and take the course as a PSW. And I also wanted to mention something about the application for permanent residency.
If you are also having difficulties finding a job under classification B, and if you are working as a PSW, you also have the opportunity to apply for your PR through being a PSW. Is a program that Ontario offers. It's called In Demand, and that program is specifically for jobs under classification C and D. Right now, the program is not opened, but they will soon reopen. I'm crossing my fingers that will be within the next month. So if you have been working as a PSW for 9 months, and of course, under your work permit, because everything you've done as a student, they won't take that into consideration. But once you have your work permit and then you work as a PSW for 9 months, you can apply for your permanent residency, even though you don't have a classification B job. So it's a program that Ontario offers. It's called In Demand. And if you have a full-time job within the next within 9 months, you can apply. And of course, when I applied for my post-graduation work permit, I had to wait for almost 3 months to get approval. I don't know if you guys went through the same thing. It takes sometimes once you apply for your work permit. And then that period when you're waiting for your work visa, they are already counting that period of time. So I've waited 3 months. Now I only have to work another 6 months as a PSW, and then I will be eligible to apply for a permanent residency. So that's another thing that you guys can look into it if you're coming, if you're working as a PSW.
That is excellent news. Thank you so much for sharing that. I was unaware of it, and I know we have a lot of students who have been working as PSWs, and they actually leave that work because they're looking for a Class B
Yes.
position. So that's really, really helpful. Thank you so much for sharing that. There's great news happening here, which is fantastic. One of our speakers hadn't joined us, and I'm not seeing her on the list, but I just want to make sure. Riddy hasn't joined, I don't believe. There is an R on but that's Rebecca. Okay, so I'm going to leave that, but we're getting very close to 2 o'clock, and I recognize that Amala's probably got to get running to work. But I'm just wondering if we can maybe get some closing thoughts, if there's anything else that you want to add, and maybe I will go through the list of folks. So Amala, do you want to start? Are there any kind of things that have popped into mind that you would like to share with prospective students or folks as they're planning to potentially make the change to come to Canada and they've got a nursing background?
Yeah, just like I said before, like if you're planning to come here, do all your paperwork or start all your paperwork from home. And yeah, healthcare administration is a good program. By the meantime you finish this course, you will get an idea of how to get into your nursing career. And yeah, read a lot, talk to persons who have been going through this process, visit this website, official Canada websites, NNA's website, read the handbooks, and yeah, that's it.
Excellent. Great. Thank you so much, Amala. And Rebecca, you see you've got your hand up. I think you're on mute if you're talking.
Now it's okay.
You're good now.
Yeah, like I work in not very big hospital. It's like privacy clinic, and before you started work there, you can just discuss with your manager about the PR, because they can be your sponsor to help you to get your PR. At least they need to, there's some standard that they have to some enough people like the citizen or PR work here as a full-time, and every year the tax will be attached to a limitation. So if you work in the clinic, you can just negotiate with your boss about let them to sponsor you to get PR. Is soon after you work for a whole year, they can do the procedure. It will you can get your PR around 4 to 6 months.
Wow.
Yeah.
Excellent. So have you got yours now?
Yeah, there is like some paper you can find from CIC. The one program I remembered is named LIM, LIM, LIAM. Another one I can't remember the name. I just download the paper, give to my manager, and let them finish. And they have to attach the certificate or something the CIC request.
Great. Good. Thank you so much. Really appreciate seeing you again as well.
You're welcome.
All right, Solani.
Yeah. So as Rebecca has mentioned, like employer can sponsor you. So that's a procedure is called LMIA, where they have to submit to the CIC that you are working with them and you will be working in future. So employer can do that, but in that process, some employer might back up because they have to submit their all taxation and they have to open up their all profits and incomes. So that can be challenging in case when you want to apply. So many employer don't do that. So that can be a challenging situation for many of the people who are working as a PSW or any other job for an year. And then if employer doesn't support, that will be in like no advantage.
Okay. But it's certainly an ability, and depending on who your employer is, I think that kind of gives some different options. I think, Solani, you dropped off at the end there. I'm not sure if we're having some wireless or some issues with internet.
Sorry, my
There you are.
internet was down. It just went
Okay.
off. So for instead of applying to the job category or job titles, if anyone will go to the company's website and search job there, because there are not only hospital, there are many social services, social agencies that's hiring for the healthcare administration personnel as a case manager, as the care coordinators, as the home settlement persons, liaison person, and there are like various roles that nurses can do. Like, so that can be a very good opportunity, and even the salary is really good. Pay band 6 they offer and plus.
Fantastic.
So
All
that
right.
can be a new opportunity.
Thank you so much, Solani. I really appreciate that. You've certainly added a lot of food for thought to our panel today. Much appreciated. Akila, do you have any comments, kind of closing ideas, thoughts that you'd like to share?
Yeah, one thing I would like to add is like for the newcomers, along with this PSW, many of the retirement homes are also hiring like unregistered care practitioners, UCP. So the retirement homes will provide like a 3-day training. If we have like a background of like nursing, like internationally educated nurses, means they will give training to those people for like 3 to 4 days, and they will give the job title as UCPs. For those people, they will give the right.
Whoops, I think you have muted, Akila. Sorry about that.
Sorry. So one thing I would like to add is like in some of the retirement homes, for those people who have a nursing background, they are hiring people as UCPs, called unregistered care practitioners. So the retirement homes will provide training to those people, like 2 to 3 day training, I think. Then those people can perform many duties that the nurses do, like medication, oral medication administration, and some things, some more job responsibilities that nurses do, those unregistered care practitioners can also do. So you can also search for that job opportunities, which is called UCP. Yeah.
Excellent. Thank you so much. I really appreciate you joining us too, Akila. You've added a lot of thought and ideas and perspective as well to the panel. So thank you so much. And over to you, Kenya, for any final thoughts or additions.
Yeah, I think everybody has covered everything, but I wanted to say, if you're thinking of coming to Canada, think no more, come, because it's wonderful, and enjoy the journey, have fun and enjoy the experience, get to know as many people as you can. The network you do, it's wonderful, it's amazing, because everybody has experience that can be beneficial to you. Like just now, this hour that we spent here, I've learned so much with you guys. I'm making notes here so I can read, do more research and go online, ask questions, and here in Canada, all Canadians are so helpful. Everybody wants to help, and it's wonderful. Don't be afraid to share, your experience, or if you're having problems, if you're having difficulties, because everybody it's willing to help. I'm enjoying it, loving the experience, and I'm sure everybody will too.
Excellent. Thank you so much. I really appreciate it. And I'm glad to be able to call you a colleague through our Providence Care side.
Yeah.
So well done. I can't wait to see you. I haven't seen you yet, but I'm sure I will one day.
Yeah.
And I do see that Angie Tingren Watkins is lurking in the background. Just wondering if she wants to pop on to say anything.
Oh,
Hi,
hey.
Angie.
Lurking, Julie. Hey
Well,
guys,
you're not
how are
lurking.
you?
You're there. You're quiet.
I'm for a change. It is so good to see you all, and I have to say that I always thought. Oh, I just lost my ear. I always thought that, as a teacher, we were learning from you. And wow, to echo what Kenya just said, do we ever learn a lot, Julie, from our students in these sessions? I wish they had been around in the early days of the program, but they're here now. So every time I finish one of these things, I'm like, yay, I'm glad I get to teach students at St. Lawrence, because I learn from you too. So thank you. Keep doing what you do. You do it so well, and we're so proud of you.
We certainly are. Thanks, Angie.
You.
So awesome. I'm going to go back off camera. I didn't put my face on today.
You look great.
You look great.
Anyway,
All
thanks,
right.
guys. It's amazing. Thank you.
Okay, well, I would also like to echo that. Big thanks. And we do learn so much from our graduates, and we hope you stay in touch. We do have that Facebook page. We do need to find better ways of being able to connect with our grads, though, aside from us lurking and stalking you on LinkedIn. So we will find better ways in the future, but thank you so much for sharing with us. And I know that the information you've provided will be helpful to so many more nurses. And you know as good as I do that we need as many nurses and nurse leaders as we can get. So thank you so much for sharing. I hope you all have a wonderful week.
Thank
You
you.
too, Julie.
For
Stay
inviting.
safe, everyone. We do worry about you. So please, please, please stay safe.
Yes.
Thank
Thank you,
Thanks.
Julie.
Bye, everyone. Stay well.
Bye.
Take care. Thank you.
Bye.
Thank you. Bye.